Marvin Goldfried is a distinguished professor of psychology at Stony Brook University, where he helped to develop the graduate program in clinical psychology. He's the co-founder of the Society for the Exploration of Psychotherapy Integration. Alan Francis is a professor of psychiatry and chair emeritus at Duke, and was chair of the DSM-IV task force. Marvin describes the evolution of his psychotherapy orientation as psychodynamic, behavioral, CBT, and eventually integrative. He practices, teaches, and supervises what works clinically using direct and indirect evidence base. Alan describes his approach to psychotherapy as whatever works, or no one-size-fits-all. He was trained and taught at the Columbia University Psychoanalytic Center, but remains equally interested in brief, supportive, cognitive, behavioral, interpersonal, and family therapies. Please enjoy this week's episode.
Hello, this is Marvin Goldfried, interacting with my colleague,
Alan Francis. Good morning, Marvin.
Good morning, and we have another episode here of Talking Therapy. And what we're going to talk about today is an attempt to see what core commonalities exist across different forms of therapy. How about, Alan, if I start giving you my view of what is common, and you, coming from psychodynamic and other points of view, if you find that it doesn't hold well with your orientation, stop me, and we'll talk. Otherwise,
I may have absolutely no occasion to speak for the rest of this session, because I think I agree with you on just about everything.
Well, okay, thank you. I appreciate that. But whether you agree or not, it's whether your orientation would take issue with it. Okay, whether your colleagues of another orientation would take issue with it. And then we can talk about that. So if you're silent, I will assume that you, at least as far as you can be a representative of your various orientations, think that it fits that model. Okay. So starting off very generally, I think in the 21st century, we need to acknowledge that the way people function is due not only to their early experiences and their later experiences, but also to certain constitutional tendencies and dispositions that we're all born with. So this is how we start off. And then we have different learning experiences in the family of origin, within the context of our cultural, ethnic, social environment, economic environment, our interaction with others. And we develop certain patterns that help us to adjust to our life as we are developing. And these experiences may be helpful. Some of them may be very, very unhelpful. Some of them may be disastrous. We reach a point in adulthood where, for whatever reason, and the reason simply could be that being an adult is not the same as what one experienced growing up. New demands are being made, and we don't have the ability, the effectiveness, the competence to deal with the world around us. And we may not have the competence because the world around us is just too severe, and there's nothing that we can do. So it's not necessarily intrinsic within us, but our functioning is impaired by external factors. So we go to a therapist, some of us, and within the context of a caring and understanding and even nurturing environment, at least an environment that feels safe to the individual, we start exploring why this is going on, why we're having these difficulties, these problems in living, and what do we need to do to be more effective or more competent in our functioning. Okay. So far, so good?
Yeah, actually, you're talking Freud. So his model was a complementary, complex interaction between inborn tendencies and early life experiences. Mm-hmm. What he was doing was carving out a middle territory, the same middle territory that you just established, between the biological reductionists, who were his teachers in Vienna in the 19th century and believed everything was biologically determined, mm-hmm. And the psychosocial reductionists and conditioning theory people like Pavlov and Skinner, who felt that we were born pretty much a tabula rasa, and everything was the result of experience rather than any contribution from inborn constitution. So you're right in the sweet spot, Marvin, between biological reductionism and pure environmentalism.
Okay, so we get agreement for the most part, and we will never get 100% agreement.
No, we will, and this is 100% agreement.
Well, there's maybe some people at the ends who say it's all biological or it's all psychological, but let's not go there at this point. For the most part, we get agreement here. Okay. So people who have written about how individuals change in various settings have said that there are stages, and there are 4 general stages. Now, what I'm going to be talking about is not the theories of the different schools of thought, and not the techniques for implementing the interventions, because the theorists within an orientation, within a psychodynamic, within a CBT will vary and not necessarily agree with each other. And there are hundreds and hundreds, if not thousands of techniques, and they're used for different purposes. So at a middle level of abstraction, we can talk, and hopefully, as you've mentioned, Alan, we find the sweet spot. So the person comes into therapy, and they explain in various ways the difficulties they're having, the symptomatology, the patterns of behavior that are not working, their relationships, their functioning at school, at work, that is problematic. And it's like, I don't know why, it's just my life is not working. So they come in at a stage where their life is not working, they're not effective, and I'm going to use the term competent for reasons that will become clear a little bit later in the podcast. So please bear with me. They're not being competent in their life. And it could be the circumstances of their life, or it could be something about them as individuals. So the goal of the therapy is to help this individual becoming aware, better aware of why it is that their life is not working. So they come in what we can call a stage of unconscious incompetence. Their life is not working, but they don't know why. So then the therapist and their patient starts to explore the different factors, different thoughts, different emotions, different behaviors, the way the behavior makes an impact on others, the way they interpret other people's functioning, and how this may be problematic and creating the problems. And these may be the factors that are contributing to their symptomatology and their problems in living. This awareness can be what's going on now, and it could also be an awareness of where it came from. And it depends on the nature of the problem as to how much you need to know about the past and how much you need to know about the present. Are we still on the same page, Alan?
You're doing great.
Okay. So the individual then moves from the stage of unconscious incompetence to conscious competence. Aha, now I know. Why? It was because this happened in the past, because my partner is doing X, because I'm being discriminated against in my environment. These are the factors, situational factors, the thoughts, the feelings, the actions, whatever they may be, and it'll be individually different as to what these factors are. A topic for another podcast. They now know the factors, and now they are in a stage of conscious incompetence. Now, the question is, how long do you need to spend in this stage of going from unconscious incompetence to conscious incompetence? Well, classical psychoanalytic people may spend a lot of time. CBT people may spend no time whatsoever. That's a function of the orientation. It really should be a function of the patient and the problem that the patient has as to how much time you spend.
Also the setting. So I've gone through all the stages in 15 minutes in the emergency room with someone.
Right.
I think brief treatments are wonderful, and you go through all the stages in 8, 12, 20 sessions. And with some patients in longer term therapy with much more ambitious goals or much worse problems, this process can take years. One psychoanalyst, and I forget who, said something like, I can cure a patient in one session, but sometimes it takes me 3 years to get to that point where that one session will work.
Yeah. Yes, it's like the actor who spends 20 years trying to make it, and then they become an overnight success. Yeah. Okay, so now the person is in a stage of conscious incompetence. And hopefully the question that they should ask is, now what? Now what do I do, now that I know this? And sometimes that may be all they need. They may, and I'm going to use a jargon, so please forgive me. All they may need is insight. All they may need is an awareness of their core maladaptive beliefs. All they may be aware of is how they're misinterpreting the motives of a significant other. More often than not, however, they need to do something differently. They need to think differently and act differently, which means they're brought to the next stage.
Do you want to joke on this stage?
You want a joke? What kind of a joke?
I'm going to give you, well, the movie High Anxiety, which everyone should see if they haven't seen it already, hilarious Mel Brooks movie. He has a fear of heights. And towards the end of the movie, he's climbing this terrible flight of stairs. The stairs give way, and he's hanging by his fingernails on the stairs, about to fall. And at that moment, under that stress, he has a memory from very early in his life when his parents were fighting over him. He was in a high chair. They're pushing and pulling him, and he falls down. His psychoanalyst, who's at the bottom of the tower, is looking up at him going through this, and he describes the experience, and he says, I understand it, Professor. I finally understand it. I know where my high anxiety comes from. And then he says something that patients say over and over again. What do I do now? And the little psychoanalyst says, climb, you son of a bitch, climb.
Right. Well, Paul Wachtel wrote a book, and I think that was the subtitle, and it was Action and Insight. We're talking about insight, bringing a person to the stage of conscious incompetence, and then to move from conscious incompetence to conscious competence. They have to behave differently, whether they're climbing, whether they're speaking up to their significant other, whether they're behaving differently so that they're less demanding to a significant other, whatever it may be. It's very unfortunate that the jargon of different orientations prevent us from seeing the similarities.
Well, Freud actually himself said that for people to gain sense, they had to have new experiences.
That's right.
And Rado, who started the Columbia Psychoanalytic Institute that I went to, said insight alone never cured anything but ignorance. So I think that what you're doing here, the sweet spot that you're proposing, is a combination of insight and action, of cognitive awareness, and then doing something based on that. Climbing, the person has to climb. They can't just have the insight.
Okay. So you're not only being silent by agreeing with me, you're agreeing with me by citing some of the psychodynamic sources.
Yeah.
I don't know if you ever saw this quote by Otto Fenichel. Otto Fenichel, for people who don't know him, he was the most impossible person to read in graduate school. His jargon was horrific. However, he published a very thin book on psychoanalytic technique in 1941. And interestingly enough, he said, if a person has a fear or phobia, they need to confront that fear. And The first time they'll become a little bit less afraid. The second time, still less. The third time, still less. Okay? This is Freud, this is psychoanalysis. CBT, it's called exposure. So here we have language that is obfuscating the similarity. The person then needs, when they're in the stage of conscious competence, to deliberately do things differently. And in doing it, we have a change. When we talk about principles of change, we can see that this is often called the corrective emotional experience, or simply the corrective experience. Now, how much time does one need to spend on this? Well, it depends. It's the same answer to the question of how much time to spend on helping a person to become aware. It depends. So if somebody has a specific phobia, it may be very, very hard to come up with many sessions where you explore the origins, because the person may not be aware of why they are afraid to speak in public, especially since many people are afraid to speak in public and are afraid of snakes or other kinds of things. So if you spend too much time with awareness, you may be off base, because you might be able to handle the problem and make a change by putting more emphasis on the conscious competence stage.
Yeah, I think another way of stating it, the simpler, the more discrete the problem, the more likely it is you can jump to the solution,
right,
and behavioral change.
Yes.
And that analyzing a phobia forever and going back to childhood can actually make it worse, because people hide behind the intellectual exercise rather than getting the person to face the fear.
Exactly.
Complex problems require more time and more preparation.
What orientation says that?
Every sensible person says it.
I know, but what orientation says that?
Well, I'll put it this way. When I'm referring people for therapy, I will always refer someone with a straightforward problem to a CBT therapist, because I'll be afraid that a dynamic therapist will muddy the waters by being too interested in the original origin rather than in the corrective experience.
Yeah.
If someone has a personality problem, I'll be somewhat more inclined to go the other way, towards someone who's going to be more, well, let me amend that. For borderline personality disorder, I'd always recommend DBT. But for other types of personality disorders, obsessive, dependent, narcissistic, a more dynamic orientation that tries to understand the roots of it and its current presentation of the person's life inside and outside the session may be, along with CBT, the best way to go.
It's an interesting point you're making, because let me put it another way. What you're saying is that psychodynamic people don't know how to treat simple problems, and CBT people using their methods have difficulty treating complex problems.
Let me put it another way. That a good therapist will be using both techniques.
Yeah.
And will be flexibly ready to do what the patient needs rather than what he's been trained to do. The good therapists, all good therapists are CBT therapists, all good therapists are psychodynamic therapists.
Yeah.
But you have to worry more about slavish attachment at either extreme, with a CBT therapist maybe being less alive to the personality features, even though Beck has written books on this, and with psychodynamic therapists being more passive in the face of what needs a more active experiential intervention.
But it says something about our tendencies to identify and follow schools of thought.
Yeah, except you and I wouldn't. I think that
I know that, and we're not alone. And I think what we have here is a discrepancy between the practicing clinician and the therapy researchers, and the therapy researchers who are researching certain schools of thought. So there is this gap, this research, the research clinical gap is as much a function of the fact that some therapists don't read any of the literature, and those people who contribute to the literature don't take into account the clinical reality. This is a whole other podcast or a series of podcasts. But look, let's go back to where we are. So we are now in the stage of conscious competence. Working through? Does that fit as a term?
Yeah, we use that term all the time.
Right. What is that?
To me, it's a series of corrective emotional experiences that build on the original insight. That you don't cure something by doing it just once. You have to make it a part of your habit pattern, which now goes into your model.
Yep. Right.
So I think the point is that the models are seamless, even if the clinicians don't always understand that.
Yeah.
All the different techniques that are useful are complementary. They're not competitive.
Right. And but you notice I haven't said a word about technique. Because I'm staying away from technique. That's another podcast.
Another topic. Got it.
Okay. But
I can't keep my mouth shut. I promise to keep my mouth shut, but I can't.
No, I know that. So, I mean, that's why I podcast with you. If we had a dialogue podcast where you kept your mouth shut, it wouldn't be a dialogue.
Point taken.
Okay. So we are now in a stage of conscious competence where you need to learn a new way. And I hope your psychodynamic folks are not too upset about the term learn, or acquire, or mature, or we need to grow. Grow is a good one. I like grow. We need to grow with new experiences. Oh, that's a good one, right? Yeah. Growing with new experiences. What's the orientation? All of
everything.
Yeah. Okay. The working through the repetitive awareness and change that goes on in the person's life over a course of therapy provides them with the opportunity to function in a new way with maybe a little bit less thinking. It becomes more and more automatic if the therapy is working, at which point they reach a stage of unconscious competence. So they go from unconscious incompetence to conscious incompetence to conscious competence to unconscious competence. Hey, I got it right. Not only did I get it right, but when I've used this with patients and when my supervisees would use this with patients, they love it. They will come in and say, oh, I had this experience I want to talk about. Let's see, I think it was conscious competence, where I realized what I was doing at the spot and I did something differently. Or they'll come in and they'll say, well, I did such and such. And how was that for you? And they say, oh, I don't know. It was just very easy. And they say, I guess, well, maybe that's unconscious competence. It gives them the roadmap.
And one thing I would add to it is that whenever there's a change, however small, it leads to, if it's a positive change, a virtuous cycle. So just as we can have downward spirals of vicious cycles when things go wrong and we become demoralized and feed into the problems that we originally had and magnify them, when the person begins to develop both the conscious and unconscious competences, they do things that are slightly different that lead to returns that they never imagined. And the progress can be not only with what they thought was the original problem, but the progress can be across many, many different avenues of their life and development.
Can you say a little bit more about that?
Yeah, like why do brief treatments work? Why sometimes does 15 minutes in the emergency room work?
Uh-huh.
You tell someone who's socially isolated, spending all of his time alone at home.
I got you.
Take a tennis lesson. They'll say, why would I take a tennis lesson? Don't just take the tennis lesson. We're not going to get insight about tennis. We're not going to get insight about why you're home alone. Just take a tennis lesson. They take a tennis lesson. They meet people at the court. someone says, you want to have coffee after the lesson. And the social phobia, which had forced the person into a kind of concrete fortress, protecting them from interactions, can gradually be worn away when there's that first little thing, taking the first tennis lesson. The first little thing has benefits beyond anything anyone could have dreamed of, because it's a virtuous cycle of positive feedback that allows more and more the person to spread their wings.
Yeah. There's another form of synergy, which is kind of interesting. And that is the synergy between awareness and action. And it goes both ways. So you become aware of something, and that may cause you to behave differently. You behave differently, and that may cause you to become aware. You know who said that? And this is a test, okay?
I flunked.
No. You will get it. I promise you. I'll give you hints, okay? This is a person who said it in 1936.
Saul Rosenzweig.
You get an A. Yes. That's exactly it. He said that there is a synergy between these things. 1936. Somebody once wrote the history of psychology. His name was Edwin Boring, strange name. And he wrote about the zeitgeist. And he said, the zeitgeist within the field of psychology is fascinating. An idea that would be unthinkable at one point in the development of the field becomes part and parcel of accepted thinking at a later point in the field. And I think 1936, people didn't understand what Rosenzweig was saying.
How about if we make our next session on that and his elucidation of the dodo bird?
Yeah, we could do that. And I also want to talk about principles of change. Now, you wanted to make a thank you and a shout out, right? To finish?
Yeah. I think that we have a producer. You have to understand how technically idiotic are Marvin and myself. We can talk, but we can't do much else in life. And we have a producer who is both maybe smarter than both of us, but also wonderful at the technological aspects that allow us to bring this to you. And his name is Alan Kian. He's a graduate student in Toronto, and we're both enormously grateful to his contributions to this podcast.
Thank you, Alan. Not you, Alan.
I know. Gotcha.
A-L-A-N, Alan. Okay. Talk to you next week. A-L-O-E-N.
And it'll be fun talking about Saul Rosenzweig, because he was really the visionary in our field.